So when you do your instrument grasp, we use our fingers. We have our thumb, our index finger, our middle finger, our ring finger, and our little finger or pinky, you can call it. When you're grasping the instrument, you want your thumb and your index finger. You're going to use the pad of your index finger right here, the main pad of your index finger. And you're going to use just the side pad kind of your thumb, or just this little tip pad, I should say, from it'll go about here to the side here of your thumb. You want those portions of your fingers to be really close to the handle, like the end of the handle close to the area where the shank starts. So the end of the handle to the shank. So you don't want to hold your instrument way up here. You want to hold your instrument close to those areas there. You want your thumb and your index finger to be kind of parallel to each other. However, you can bring your index finger up slightly if you need more control. Your index finger and your thumb should be holding the instrument, controlling the instrument more. So you keep them parallel to each other, but you can move your index finger up a little bit. Notice my fingers are in a C shape. So my index finger and my thumb are rounded out. They're not dropping in like this, okay? So you want your fingers to be in a C shape as well. Also notice where the instrument is laying on my hand, between my knuckles here, the handle. Your handle should be typically between knuckles 2 and 3. Sometimes if you're working on the maxillary, it'll fall into this little pad area here, the little cup in your hand, and that's okay too if you're working on the maxillary, but typically you want the instrument to rest between knuckles 2 and 3. Your middle finger, the side or just the side pad of your middle finger, is going to rest on the shank of the instrument. So very lightly on the shank here. So if you see, the side of my middle finger is on the shank, not the middle of my middle finger, just the side of my middle finger is on the shank there, okay? The shank is used, and your middle finger is used on the shank because that gives us our tactile sensitivity. The vibrations will go through the shank, and it'll help us to determine if there's a filling, an overhang, or calculus, or any anomalies in the tooth. We can feel that through the vibrations. We call that tactile sensitivity, okay? So once your hands are there, now your ring finger is straight, okay? Your ring finger straight, that is your fulcrum. So your fulcrum is straight. Everything else is kind of not rounded, but they're all touching each other. And your ring finger is very, very straight. It should touch your middle finger as well too. Now your pinky has no function, or your little finger has no function in the grasp, but it should be laying nice and close to your middle finger. It shouldn't be hanging out like this. No teacup fingers, no teacup pinkies. Keep it relaxed and tucked right next to your ring finger. Another thing that's important with your grasp is to make sure that you are not splitting your fulcrum. So if you notice, all my fingers are together, they're all touching at some point. You don't want to fulcrum, let's say if you're fulcruming on the patient and you're working and then your fingers are split apart. You don't want to do that. You also don't want to split any other part. So look at my index finger and my middle finger. You don't want those to split. You don't want your fulcrum to split from your middle finger. You want everything to be together, almost as if your hands are glued together. Every movement, even when you're working, all your movements will become fluid with each other. You have to roll your instrument and pivot on your fulcrum as well, and that will prevent you from splitting your grasp.